Tomotherapy was a concept that was developed in the late 90s and fundamentally differs from linear accelerator-based radiation therapy in that the gantry rotates around the patient much like a CAT scanner. You treat a smaller field, but the patient is moving as the patient is getting treated, and so you have the movements of the gantry like a CAT scanner around the patient, treating a slice of the patient and moving on. Each slice may be up to 5 or maybe 8 centimeters depending on the clinical situation. So the patient is treated in a slice-wise fashion in contrast to an open-ended field or an open field that's generally done on a linear accelerator. It brings in radiation from several different angles. The conformality or the ability of the tomotherapy to deliver dose is best when you are treating cancers which demand that you spare critical organs, the eyes, the optic nerves, the cochlea, the hearing structures, and that's where the tomotherapy is best utilized in the head and neck area. In contrast to that, in the prostate, you're giving a very high dose against a structure like the rectum, which may not handle the radiation very well. So the tomotherapy works there well in a prostate cancer because it's able to define and protect the rectum a lot better than that can be done with some other modalities. The tomotherapy is able to manage a higher weight than a lot of other machines, and the advantage of the tomotherapy also is in the reproducibility, the ability to do a scan, a CT scan, and ascertain the validity of the treatment before each treatment. And so the essence of radiation lies in reproducibility and also in the fact that you are able to exactly view what you are treating every day on the machine, and the tomotherapy is a very good example of a machine that does that. We have been the leading users of tomotherapy in the Bluegrass region, and I'm not aware of any other facility in the Bluegrass that has been using this mode of treatment or has this kind of a treatment planning, because it's not just the machine that's different, it is also that the machine has a different software component, and the computers that it uses, the treatment algorithms and the calculations are different. The IMRT as a treatment, and especially tomotherapy, requires a lot of quality assurance. We have a very good medical physics division here which does that. Quality is of the essence in radiation oncology, and our department has a very strong and a capable physics department that backs the physicians in what they do.